No medicine can remove the cause of a lifestyle disease, but you can. Welcome to this before and after series on lifestyle diseases. Here we look at what happens after an angiogram and what are the treatments available after that. And in this fifth episode, we look specifically on examples of how clinically supported lifestyle conditions have helped patients overcome their heart related issues. To begin with, we have Dr. Jolly, who has extensive experience of almost 35 years in treating patients of lifestyle disease, especially those related to major organs like the heart, and how she has actually been able to overcome the requirement for surgery and other procedures in many cases for patients. To begin with, Dr. Jolie, what is it that happens when a patient is able to avoid a stent? What is the background of such a patient, and how do you think that has improved his future possibilities of his heart health?
Definitely, that is the most common scenario in my center, basically in my clinic. And many patients come, they have been asked for a stent and they wanted to avoid. And I can tell you a few examples about that. And this is one example is this is a 49-year-old man. His height is 170 centimeters and weight is 71 kg. Not much overweight or anything. But he had a sudden chest discomfort and taken to the hospital. And it was a ST segment, STEMI type of ST. Clear evidence in the ECG itself there is an attack. And immediately he was put for the primary stenting. And they were able to, the angiography, there were three vessel disease. All the three vessels were having atherosclerosis and blocks were there. And they were able to, because his condition, because already a massive attack was there, so it was put only one stent and asked for a phased stenting. After a few days, when he is more stable, they will put one more angiogram and angioplasty. That was he was advised. And while he was in the ICU, he was able to watch the videos, and that is why he came to me actually. And after 3 days, he was put on another, before the second angioplasty, when an echo was done. In that echo, there was some clots inside his heart chamber. That is, apical clot was there. So the doctor said, because there is a clot inside the blood, this thing, it is, we will wait for 1 month and then put the stent. So after getting discharged from the hospital, he came directly to me. And when we look into his blood parameters and his case records from the cardiologist itself, was clear that there is a massive attack was there, and he was on heavy medication. His main complaint was he's very tired. He's feeling very tired, and so many medicines was there, clopidogrel and divabran, this apixaban, that is to clotting, because he has already put a stent, already the heart clots are there in the heart. So he was on blood thinner heavy dose, and ivabran, flavodone, those are cardiac medicines, and spironolactone, telmisartan, metoprolol, so many medications for stopping, controlling his BP, and atorvastatin for controlling cholesterol, high dose 40 milligram, and torclip and the metformin and vidagliptin and dapagliflozin, through three medicines for the diabetes and also insulin twice a day. When we look into details of health problems, his diabetes for the last 10 years and taking medication for that. And his creatinine was also after 1.2. That means he's already in the grade 1 renal. Basically, kidney also is affected, and maybe because of this long-term diabetic patient. And also fatty liver is there, and BPS, that is prostate hyperplasia is there. And he is complaining of this penile strictures, and also that is it's a very rare disease. Actually, it's not diagnosed before, because after the ultrasound scan and all, we have diagnosed an autoimmune disease called a peroneus disease, actually, because of this. That is, I'm not going into the other details. Actually, we'll focus on the heart itself. Actually, we are treating the patient as a whole, not the heart alone. So that is why we are looking into all the parameters. And when the blood test itself, he was showing the insulin level was so high. He's diabetic and taking insulin injection. And this insulin level itself is creating his problem. Insulin has a problem. One is it will give a sodium retention. Sodium retention means the hypertension. That is why many of the patients, after diagnosing and starting treatment with the for the diabetes, they, even though they don't have the hypertension, they will get a hypertension eventually. Because most of the medication for the diabetes is actually oral tablets are increasing the insulin level, many of them. And also you're putting type 2 diabetes. If a patient is type 2, it's type 1 diabetes means there is the pancreas is not producing enough insulin. But type 2 diabetes, the pancreas is working, and many of the patients, the pancreas is overworking. So this patient also, pancreas is overworking, and along with that, he's taking injections, so his insulin level is very high. Actually, this insulin level not only increase the BP, it will damage the blood vessels by making the endothelial dysfunction. It is nitric oxide, that is a vasodilator, and its production is blocked. So that is the reason this cardiac patients, this diabetic patient go to heart disease. And also this glucose is damaging. Glucose is definitely damaging the blood vessels, and endothelial damage is happening. Along with this, insulin also is damaging. So the disease, diabetes itself, and also the medication is acting against the blood vessels and damaging the heart. That is the reason for this heart attack for this diabetic patient. And also when the BP is increased, the heart workload of the heart is increasing. So there will be so many mechanisms. There will be the cardiac muscle hyperplasia, that so much of a heart muscle, so it needs more blood, but the blood vessels are getting narrowed. That is the reason. For this patient also, this is the same. The problem is he is having hyperinsulinemia, even with that also the HbA1c is high, and even the other PSA also. I'm not going into that parameters. So many other problems also was diagnosed. That is he's having some autoimmune condition also. That is with this young age, he's getting a heart attack because of this autoimmune problems, which is promoting the clot formation. That is why he's having a clot inside the heart also.
Actually, you are telling that this patient had multiple issues and all. And you also are telling that you treat the patient as a whole, so that it is not only the heart, but other issues also that are. So you are mentioning about this high insulin levels also. But patients generally, when they come for a heart problem, they normally don't bother about the other diseases and issues and all. But how does actually, what should patients like him know that if their insulin level is high, it is actually affecting their heart, and the chance of attack and all is very high when you compare it with other issues. And what is it that can be done to lower their high insulin levels?
It is very easy for me with this my CSLC-CAP. That is what I call for this this treatment method itself. In this with the it has two aspects. One is the diet, and that we call it is a CAP diet, and that is the diet is for stimulating your immune system, and also the exercise pattern called oxyflux, that is also finally focusing on the immune system itself to correct your body and correct your body parameters and the macro level and at the micro level and at the molecular level, and reverse the disease. Actually, for him, actually this his insulin level, we checked the blood sugar at 4 times at home itself, and he was able to come down. His when we are coming, he's starting even with all this insulin, and he was under pakka because after that attack he was very worried, and he was under control at home. So the diet and all was under control, even though his HbA1c was 8.8, and his HbA1c came from 8.8 to 8.1 within a week, and his insulin level was, and by the second visit it came down to 7.7, that is 15 days, and his insulin level actually only after 30 days. Nowadays I check insulin level every week itself. It's sometime 2 years back patient actually. So that time only, but actually the insulin level comes down very fast. Just like when you are in the correct diet, blood sugar can be controlled without. Actually, you should mind that you should understand that We start this type 2 diabetic patient, we stop all the insulin, diabetic medicines and insulin injections, all the 3 diabetic medicine and insulin injection the first day itself. But in the first day, within 24 hours, his blood sugar was under control. And the insulin level also, if you check in the after the 8th day itself, insulin level will come down, and depends on the patient to patient. This patient, it is only when you come for the 30th day, his insulin level is 2.13 only. It's very low normal actually. And his blood sugar was 94, and HbA1c is 6.5, from 8.8 to 6.5. That is the result. So every parameters, and he was on so many medications, and by the 15th day itself, he came down his medications to reduced only the actually, yeah, we stopped they reduced the tapering of this statin and the cardiac medicine slowly, because he has so many medicines, and he was having immediate attack. No, by the 30th day, he is taking only this blood thinners and this Elaxiban twice a day, and ecosprin once a day, and Pantop, that is to this anti-acidity agent, that is to prevent gastric problem because of this blood thinners. So all the other medicines he was able to come out, and his blood parameters were come down. Only the HbA1c came down. By the 90th day, his HbA1c is 5.3. Understand that it is without medicines. And also when you are coming on the 30th day itself, without medicine, his BP is 100 by 60, without any antihypertensive agents. And by the first month itself, it is the medicine is over. Actually, he has come for the 1 year visit also, this 1 year review. When he came also, his HbA1c is 5.6. Without medicine, no medicine, his HbA1c is 5.6. And his almost, he had other problems also, that those problems also was got solved. And that is the result actually. That is actually, if you have, and for me, if the real treatment is, if you are able to come out of the medication. If you put the stent, also you had to take all this medicine and this person, because this person, this patient, he had to undergo that emergency stenting was needed. That is a must, because it is a massive attack and immediate, whatever is possible. If the clot said that also there is now facilities available to suck out the clots. If it is a clotting mechanism failure, it can be removed from those things is essential for this person. And also there are medication for to lysing the clots also. So such medicine definitely is needed. It is all lifestyle. But the final thing is the lifestyle correction, and he was able to come out of all the medicine. And the second, by stenting also. Actually, he was visiting the cardiologist, and he was asked for the second stent, but because he's corrected with the blood pressure, sugar, and everything, he said he will be waiting and seeing. And after 3 months, actually, we did repeat cardiology assessment with echocardiogram and CMG and all. His cardiac function and the muscle wall improvement was very much. So physically, he was very tired, and he was, after coming out of the medication, was feeling energetic, and he started going for work and doing fine. And now after 1 year also, he's doing fine.
Actually, when we talk about lifestyle correction and all that, basically what we understand is most people, at least most patients, feel that it is a slow process. It will take a long time and all that. Generally, the feeling is that the reasons or the cause of this disease has developed over many years. So to remove the cause, if possible, or reverse the disease, it should take that many years. But from what we hear, it is like one first day, then 7th day, then 15th day, then these tests are showing at each of these days that much of change. How does this particular situation affect the patients? What do they feel when this change is so fast?
Most of the patient, especially the cardiac patients, when they come the next visit itself, they will be very comfortable, and they say, feel a lot of difference, doctor, and feel much energetic. That is not only this patient, almost all the patients, especially youngsters, they feel much relieved after the tying, they are tied with so many medicines that their functions, cardiac function actually is blocking. Heart and blood vessel function is all in a mess with all these medicines actually. Which medicine actually, many of these medicines really, we don't, the medical field also, the researchers also don't know how all these medicines are acting on different part of our body. So when you're taking a medicine, it's not going to the heart alone, it is going all to the cells in the body. So this patient here also, how this fast result in this clinically supported lifestyle correction, how it is happening, that also the patient also should understand. Here again comes the immune system. So we should understand the immune system working, how it is, and the replacement of, actually the repair of the body is happening because the immune system is replacing our cells. Every second there is multiple millions of cells are replaced with the new cells. When you give enough nutrition and enough exercise to make this nutrition reach all the cells in our body, the immune system will replace all the damaged cells. In the heart patients, which part of the body is maximum affected? The blood vessels, the endothelium, the lining of the blood vessels. So what is the turnover time of this blood vessel and these cells? That is important. Actually, this lining cells, the turnover time is very less within almost all the cells, lining cells of our different organs, including blood vessels and also the respiratory tract, gastrointestinal tract, and all is very fast. It is, many of them is 4 to 6 days or 7 days or 5 to 10 days, and it is all depend on the all organs actually. The cardiac muscle, it may take you 1.5 years to 3 years for the muscle replacement, new cells to grow. But the lining, the blood vessel is very fast. Even the immune system, the most active, we all know that white blood cells. White blood cells, the turnover time is too fast. It is only 3 to 7 days. But the hemoglobin, that's red blood cells, that is where we are looking into the HbA1c. HbA1c correction, it will take almost 3 to 4 months, because the turnover time of this RBCs is 4 months, 90 days to 4 months. But in youngsters, if you give correct nutrition and all, it will start very fast. That is why this person is HbA1c 8.5 to within a week it came down to I think 5. HbA1c came down from 8.8 to I think 7 point something. So that is because that much blood vessel, the damaged RBCs is replaced. So the repair mechanism is also directly depends on the turnover time of the cells. The different cells have a different turnover. The lining of the blood vessels and the blood WBCs itself is very fast. That is why the result also. So that is very, I don't think any other medication, only thing painkillers can give instant result. No other medication can give this fast result.
Actually, it is very difficult for normal people to understand the pace of this correcting lifestyle and its impact on heart health. Many patients, when they hear that their heart has a problem and some procedure is to be done and all that, generally they have a feeling of fear, because surgery and all that. Generally, there is a feeling of fear. So, in your experience, when such patients have this problem of facing a surgery and all that, what is it that actually they can possibly do to avoid a surgery if possible? And what is the preparations that they should do to understand the better solution?
See, for my patients, those who are coming to me, is basically hearing this videos. If a heart patient coming, there is watching my videos, and they may be looking for in the net. They will be looking what is the solution. So they may luckily they will come to across with the videos, and only those who are able to get some understanding, and they will watch more videos. And also there are clinic case studies also, that is like this sort of patients case study, what happened to each person, and they go through that, and they think that it is true, because in the net we cannot take it is very difficult to the understand which is correcting and which is cheating and truth, and it is very difficult to understand the truth and untruth nowadays distinguish. So they have to make a study, and if they believe, they come. and they start treatment. And the major blocking factors actually sometimes the parents want to do they are understood, but the children are not do the homework. They have to do some homework at least to do at least 2 or 3 hours of watching the video is needed to understand this, because it is not the conventional treatment methodology at all. The treatment methodology, everyone, if a bypass, if not doing the bypass, it is end of the life. That sort of belief is there. So they had to understand what is bypass, and so but with the people now, everyone is intelligent, and even you can see the bypass surgeries are there in the net itself. You can watch it, and what is the complexity and the side effect, everything you can get from the even the ChatGPT or the AI. There are different type of AIs are available. Even in the Google search, there is there. They'll give you almost all the side effects and all. But it will be very difficult for you to get about the result of this treatment methodology, which is not in the main field. But if you check with the CSLC-CAP or Dr. Jolly Thomson Life Care Center approach, you can get a lot of information, and you can look into the website also. So you can go, the patient who is looking for a solution, or those who want to avoid bypass surgery or avoid angiography or stent, or even though you had all these, and even you want to come out of the medications, not only for the heart medication, diabetes, hypertension, and everything, you look into the website and see more videos and find, if you are feeling convincing and if you are confident about your own immune system and your ability to correct your lifestyle, you can definitely, if it is if your organ is not too damaged, definitely you can get the result.
What about the patient example that you can take who has the fear of surgery?
There are some patients who are coming not because of much of understanding. They are not looked into the video and find out what is the reason. And in the website and all, only those who can deep understanding only will be able to find out. But one patient I can tell you, this is a lady who was just purely because of the fear she came to me. She's a 55-year-old lady and 155 centimeter height, and weight is 57 kg. And she's diabetic and hypertensive for the last 20 years, and she's not with much of overweight or anything. And because of a sudden chest pain, she was taken to a hospital. And when they looked into, she had this ECG changes, ST segment elevation was there. And she was advised for an angiogram. And primary angiogram and angioplasty they were planning. But she was very worried about this thing, and she doesn't want to undergo that. Just like the same patient, actually, he had a massive attack. She also had a massive attack, but she was very frightened for going for the surgery. And her troponin level was 7,783 when we are. So it's very high troponin level. That means she has undergone a massive attack, and she had pain, abdominal pain. But initially, when she was coming to me, she was not knowing that this troponin level, which is the result was, I got it only next day. Then she came actually in the end of the OP time. Actually, my regular OP time is only afternoon, 12 o'clock. They come from the little far off place in the North Kerala. And one of her relative had treatment here, and he was able to avoid the bypass surgery. That is why they know about me, and they came to me. So because at that stage, that day I was not able to start the treatment, but because of her pain, and he was not, they took their own, they got on their own, they get discharged from the hospital ICU actually, and their own risk. So I had given her the pain relief and this sublingual tablets, basic. That is the preliminary. That is basic thing I had given in the first time pain relief and all. I asked them if they have any problem, they had to go to the hospital, but she was not willing for going to the hospital. Anyway, complete trust and take this medications, and especially sorbitrate and some pain relief medicines and anti-acidity medicine, because she's having chest pain and abdominal pain. So I had given the medicines, and they went home. And if she's getting relief, she can come in the morning. That was that. And when the result come, this troponin was very high. It is clearly a massive attack, and the HbA1c was high, and the blood sugar was 309. And HSCRP, CRP, and all this HSCRP cardiac mark is too high, 269. You usually see it to 5 or 6 or 7 and all. And ESR is high, so it's a very high inflammatory stage, her condition. Anyway, we started because she's symptomatically free by the next day because of this preliminary emergency care itself, she was settled. So next day when we formally started, and the 8th day, her troponin level came down to 1075. And in the 15th day, her troponin was 158, and by 30th day, troponin was normal, 10.9. So by 1 month, this cardiac troponin level doesn't mean that the heart is completely cured, because the heart muscle repair, it will take time, because we are giving the optimal nutrition actually. So even this correcting the immune system, the omega-3 and omega-6 balance, we are trying to correct it to 1:1. So ideally, it should be less than 1:4. We are correcting the optimal level 1:1. That is why this fast result. And her HbA1c also came down from 9 to 8 by the 30th day. And by the 90th day, her HbA1c was 6.1. That all without, she was on other medication for the diabetes and all, without any medicine. This her blood parameters corrected. Her HbA1c came down to 6.1. Blood sugar was corrected in the first day itself. Within 24 hours, blood sugar was corrected. And HSCRP, actually HSCRP came down from 269 to 8th day, 33.2. And by 30th day, it has came down to normal, 0.4. So we are actually in this clinically supported lifestyle correction, where we are treating is the immune system itself. The providing the optimal nutrition for the immune system and optimal exercise for the around 50 trillion cells in the body is there. And we are trying to optimize the stimulation of all these cells. That is called, that's why it's called cell activation protocol. CAP protocol and CAP diet, we are following this. And the result is so fast. And many the patients and the doctors will not be able to believe it. Only you have to experience it and try to understand the reason why this result is. Because this is the need of the day. Because we are not in a lifestyle diseases are increasing. Heart attack and sudden death is increasing. And even though we put the stent or the bypass or all the medications you are taking, your attack is attack and the untimely death is becoming more and more common. So we should understand, we have to go to the root cause. And our real doctor or the real healer is the immune system. They correct the immune system. It's an inflammatory disease and our inflammation is there. Correct the inflammation. There are so many markers for the inflammatory markers, CSR, HSCRP. This patient's ESR also was very high. And that also came down. ESR, HSCRP, CRP, all these parameters also came down. And the patient is okay. After 1 year also, she had a 1 year follow-up also. She's maintaining her blood sugar also without any medication.
Actually, when it comes to diabetic patients, because most of these heart patients have diabetes and or BP and all that associated with it. When it comes to diabetic patients, it seems that this bypass is usually more often performed. But at the same time, we understand that the diabetes as such continues with the patient. Even after the bypass and everything is done, diabetes is there with the patient. So the patient is again getting ready for another event. So what is it that diabetes patients should particularly know? Can you give with an example, this serious diabetic patients? Because always what is happening is diabetes goes on, then one event comes, like a heart attack or a complication of diabetes. Then only everyone gets going. Then the centers of excellence will treat the event, and then everyone is waiting for the next event. So what is it that patients like that, can you give with an example?
Yes, that is the current scenario. The hospitals are for treating the events actually. So attack, hospital can. But preventing the attack is the patient's responsibility. So the doctors will not give much of they'll say that take the advice of the dietitian, go to the gym or do the activities, walking, swimming. So many advices that it has to be implemented by the patient. And with all these medications on eating a handful of medicine 3 times a day, and they will not be able to do it successfully. That is the problem actually now is happening. So that lacunae, I am actually with so much of effort, developed this protocol itself to cover fill that lacunae of how to correct the lifestyle in a systematic way. And it can be achieved within 3 months actually. Initial treatment protocol is 3 months, and then we taper off the support. And by the 6 months, the patient will make the patient to manage themselves without medicine. This patient also having a high insulin level, 28, not like I had seen up to 250 and 300 insulin level, but she had only 28. Maximum level generally taking is only 25. And her insulin level also came down. And usually I prefer to the patients to keep the insulin level around 4 or 5. And sometimes it is seen that it is only 2 or 3 with a normal blood sugar. That's only that much. If the insulin resistant, if your hormone system and everything is functioning normally, insulin level will be around 5 only. So, but many of the insulin resistance is there, and we had to correct that. And you had to go into the details of the patient, and it is very easy if the patient understand, and if you get a correct doctor to guide you in the lifestyle correction, then it is within 24 hours blood sugar can be controlled. That is my experience usually. Only if some patients the craving can be there. In such there is also we have mechanisms to deal with the craving also. I don't have the time to explain it here, but there are other videos about this whole CSLC-CAP program itself and how it is, and all is described in different videos. And those who are interested, especially the cardiac heart patients, diabetic patients definitely going for attacks will be very common in them because the blood vessels are getting damaged. So find some time to go into the details and understand the mechanism of this clinically supported lifestyle correction. And many, if you are not in a cardiac, in the emergency situation and all, those in a mild medication and all, you will be with the seeing the videos itself. Give you ideas, and I had many patients come and tell me that they are able to, just watching the video itself, they are able to come out of the medication also. But that is possible if you are not enter into the complication. But if you are a heart patient and taking so many medication, it will not be wise to go alone without guidance. Always take guidance and do it. I'll give an example of a patient who was already a diabetic patient for the last 35 years. He's a male, 65 years and 165 centimeter height and 76 kg overweight also he's. And he's diabetic for the last 35 years, hypertension 20 years, heart patient for the 18 years, and then BPH also, prostatic hyperplasia also is there. And he has undergone CABG, that is coronary artery bypass surgery, 2006. And again, angiogram and angioplasty in 2011 and 2020. He came to me in 2023, and that is after a failed stenting. That he had calcified plaques, and they tried this retractor sort of this breaking the plaque and putting that stent, and it was ended with a problem, and he was not able to do the stenting, and he was in the ICU for almost 2 weeks. And then after discharge, he came, and he had a severe angina. Even the resting not much problem. He was finding it difficult to taking bath and doing his own activities. So it is very difficult condition. And his next option is only, he cannot undergo any of the procedures. And his next option is only heart transplantation, but it's not that easy procedure. So this patient also, he was able to come out of his discomforts and come out of so many medicines, diabetes, insulin injection, and everything was there. And his discomfort also is reduced. Actually, by the 30th day, we asked the patients to, every visit, we'll give a progress assessment chart also. There is a system to write it also. In the 90th day, he's saying that there is a just slight discomfort, dyspneic, he's becoming dyspneic when he's walking fast. So before that, he's not able to take a bath itself. And by the 90th day, he was able to come out of all the medicines. And because he has not put a stent. So he has come out of all the medications because the stenting was failed. So he has come out of all the medicines within a month itself, and his exercise tolerance has increased. But he had this blocks, CAMT was also showing problem. So he needs more time. It's to come out of all the plaques and all, it will take more time. So the patient has to follow the directions and this protocol. For they did not usually we give active active support for the first 90 days, and then by gradually making the patient independent. And by the 60th day, only once in a year, after 3 months also, usually we follow it up on the 270 day, and then yearly. And if the patient is more of, depends on the patient also, every 6 months or 3 months, 1 year follow up. And that is the pattern we are following.
Actually, when it comes to patients, heart patients, generally we see that the blocks are not only in the heart vessels, but the blocks are there in other organs also, like the kidney or even in the other blood vessels of the leg and arms or wherever. So, what is it that actually patients can learn from any example where the treatment was not only for the heart but for the other blocks also along with it, because generally when we see treatments like bypass or angiogram and stenting and all that, it is for the heart usually, and when it is done for the heart, it is basically focused on the heart only. So how is it that lifestyle correction can treat it on the whole body's level?
We are always thinking about the heart. Prime importance will be given to heart. So heart, if you should understand that if you have the blocks in the heart blood vessel, there are other part of the blood vessel organs, other part of the body, other organs, kidney, liver, legs, etc. Also, or the brain itself, brain, the very gentle or very fragile blood vessels, they all will be affected. So if you have a heart attack, or the possibility is there, or you had a heart attack, you are prone for a stroke also. Everyone should remember that. And also your kidney may be failing. So we'll wait, usually wait till the end. You should look for a GFR. If the GFR is coming below 90, you should take care of that also. And most of the patients will be having fatty liver, but generally the patients will ignore that. And even the doctor, because there's no treatment. For the kidney failure, there's no treatment. Only at the end stage, you can do the dialysis or the transplant. Or the liver also, there is no treatment. Fatty liver, cirrhosis, fibrosis, no treatment. So modern medicine is helpless in that. But you are not helpless. You can correct it. With the lifestyle correction, you can reverse the fatty liver. And many of the culprit for the fatty liver also is high insulin. I'll give an example of a patient who is suffering from peripheral artery disease along with the heart disease. And this is a 72-year-old man. He was actually he's a US citizen actually. He's Malayali, he's a Keralite, settled in Indian, settled in US for the last more than 40 years. And his height is 158 centimeters and weight is 68 kg. And he's suffering from diabetes for the last 35 years, dyslipidemia 5 years, hypertension 10 years. And he was undergone a bypass surgery in 1 year back, in 2024 actually. He came to me in 2025, this year only. And he was, his problem is, actually he wanted to try this clinically supported lifestyle correction before his heart surgery, that is bypass surgery. But his children are doctors, and all are in the family also. So many doctors and medical professions are there, and they didn't allow him to try this. And after the bypass surgery, also he's not able to walk even small distance, and his leg is his foot is getting darkened, and he's worried that he need a amputation or anything because he's diabetic also. So that in the US, they are said that you can put a stent in the leg vessel also. Leg vessel, that is the only thing they can offer. But even the small, the foot blood vessels, that is very small blood vessels, there you cannot put a stent in the foot and all. Only the major blood vessel of the major blood vessel of the leg you can put. But even if you put the stent, the distal part of the artery also, because diabetic patients, small arteries also will be affected. So no use of putting the stent, and even damage, because in the possibility of clot formation of the stent and blocking the major blood vessel itself is a great threat. So they finally came down to Kerala and they started treatment. The beauty of this thing for the peripheral artery disease, you can to see the do the Doppler study and see the opening of the blood vessel itself. Initially, many of the blood vessels, that's we can see how much blood flow is there and all. And within 2 months itself, many of his blood vessels have started opening. If the leg blood vessel is getting opened, definitely the heart blood vessels also can get opened. Only thing, the problem is the coronary artery, we cannot put the stent on that, and because the rib cage is there, thick chest wall is there, we cannot directly do the Doppler study there. But in the other, that is why in the clinically supported lifestyle for correction for the heart patients, we do routinely CIMT, that is carotid artery intima media thickness. That is the as a measuring the fat deposits inside the major blood vessels which is supplying the brain. And if they have any leg problem, peripheral artery disease is there suspecting, we do the Doppler study of the artery for the leg. And we can see these blood vessels are getting opened. And especially the food blood vessels and all, the dorsalis pedis and all, it's all medical terms, the name of the artery and all. It's all getting opened actually. And we can see, and also this patient result, the patient is able to walk. That is the most important for the patient. Patient will not be, but now not in the medical, the blood reports or the Doppler study is important, comes only if they get a relief. And when we do this test also, it is getting opened, it is much relief for the patient. It is they are getting symptomatic relief, and it is evident in the report also.
When patients who have undergone bypass surgery or stenting, their most important criteria condition that they would like to know is what happens to their medications. That is, in case you are treating them under this life care correction program, what happens, because they will be under the belief that they have to take medications usually lifelong, and that is what is generally the concept.
See, basically, those who are interested in this clinically supported lifestyle correction, or anyone who's having a heart patient should be interested in that. Then only you can come out of this. So in this, you can, if you are not put a stent in the last 12 months, you can, most of these cardiac associated medications like diabetes, hypertension, and these things, you can come out within a month itself. But if you have put the stent within this 1 year, that blood thinners, you have to continue. That is a must. Otherwise, that is to protect you from the side effect of the stent. Otherwise, you can come out of the medication within a month itself. And basically, the takeaway from this, my suggestion to the patients who are had a angioplasty, bypass surgery, or having advised and not done, or whatever they have undergone also, if you are willing to correct your lifestyle, you can come out of the medication within a month itself. And only variation, this exception is we have to test it. So you should be willing for that. You can feel it. No one can. Most of the patients is telling me that, doctor, I never thought this much relief when this is possible. But many are because it is against the current norm. There is no treatment like that. I don't think in any part of the world such a treatment is such a clarity and with evidence-based medication, evidence-based service for this lifestyle diseases like this is provided. Because I know I get different parts of the world, the European countries and the African countries and Australia, New Zealand, and everywhere, US, every part of the world, I get patients, and it's mainly these Indians itself are coming to for this treatment here. And I see there is nowhere else in the world this sort of a protocol or treatment schedule is there. If anyone, this patient also, they came down to here, and because they are a native of here and they are already retired, They stayed here for the 3 months, and by the 3 months, everything is all the medicines. He's also came out of medication within the first month itself, and cleared his problems and gone back. Only thing they are worried that how what in American citizens, they are always worried that, doctor, what will I do? They have their insurance. Then people will look for whether I am taking the medication regularly. Why should I take all that medicine? That if the person who is not having diabetes or hypertension, they cannot take such medicine. It will be harming them. So they are usually what they do is they tell the doctors they are taking the medicine, but the doctors are checking the blood and blood parameters. It is checked. It is everything is normal. So it is very difficult. The patient find it difficult to tell the truth to their physicians, especially here. It is not in India. It is not a big problem because they don't need much of the other care also. But in Western countries, it is the insurance point of view. They have to take all these medicines, and otherwise it's a problem. They will not get the insurance coverage and all things. Such problems are there. But the thing is, you can get out of your problems if you are willing, and if you are not too late.
The simple thing is that lifestyle diseases, actually, no medication can cure a lifestyle disease. The only cure comes from how you manage your lifestyle. The rest is all temporary corrections which give you time, but the time is really meant for you to decide on how you will correct your lifestyle to prevent a recurrence of the event. Thank you. The informed patient is key to treatment success.